September 10, and I'm going to be demonstrating on how to insert an IV. So first thing I would do, I would knock, I would identify myself, tell the patient what I'll be doing. I will ask her name and date of birth, allergies, and I would recognize my general principles and safety practices. All right, so first thing I want to do, I want a hand hygiene. Put on some gloves. I'm going to kind of inspect her arm just to kind of find a vein, right? All right, so now I'm going to go ahead and spike my backs. Keeping it sterile. Okay. So it's rolled off. There we go.
Okay.
Alright, and my bag up. Okay, I'm gonna prime my tubing. Get all the air bubbles out. Okay, so that's primed. I'm gonna also go ahead and do my piggyback tubing, my secondary bag, just so I can have it ready. Prime that tubing. All the air bubbles are out. All right, I got those finished. All right, I'm just gonna remove my gloves, hand hygiene, and apply some new ones. Well, I'm gonna go ahead and get my supplies ready before I do that. All right, so I've got my J-loop, and I've got all my IV start kit. Set it right there. I'm just going to put the tourniquet underneath just to have it ready. Okay. Now I'm going to prime my J-loop. I'll go ahead and put on gloves. Okay. Hand hygiene, gloves. Now I'm going to prime my J-loop. And this is sterile, so I'm going to keep it as sterile as possible. I'm going to prime it and then leave that part in the bag right there. Okay. All right. And now I will start the IV. All right, so I'm going to do the tourniquet. Kind of feel. Alright, we're going to scrub, scrub, scrub. Then I would let dry for 30 seconds. While that's drying, I'm going to go ahead and get my needle ready. Okay. It's been 30 seconds, so I'm going to start. I'm going to retract the vein a little bit. Make sure the bevel is up. Go in at a 15 to 20 degree angle. Okay, advance my catheter. Okay, hold some pressure. Gauge my safety. Put some dressing underneath there. Get my J-loop. Okay, holding that still, going to aspirate and flush. Make sure there's no infiltration, no burning, no swelling, any redness or anything like that. So, kind of hold it there. That icing away. Okay. Put my Tegaderm on. Then I would initial, date, and put the gauge down, which is a 22. All right. So then I will secure my tubing with, if I can get it. Hang on. Can't get the tape. It's right there. Okay, sorry about that. Technical difficulties, user error. All right, so we're just gonna kinda secure that. There. Okay. Now that we've done that, I'm gonna remove this. I'm gonna get my alcohol swab. Scrub, scrub, scrub. And I will hook up and release that tourniquet. I'm going to start my primary tubing. Okay, make sure that is dripping well, and it is. All right. Next thing I would do, I'm going to remove my gloves. And also I would assess the site, make sure there's no redness, the patient isn't feeling any burning, no infiltration or anything like that. Okay, I'm going to clean up my supplies. And the next thing we're going to be doing is pushing a medication. So, let's see, get my supplies ready. Got my medication, my saline flush. All right, hand hygiene, gloves, and I would tell the patient what I will be pushing. Make sure there's no allergies to it, no medications that she's taken that could affect this. All right, so I'm going to scrub the hub. Scrub, 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 scrub. I'm going to flush with saline first, aspirate, flush. Now add scrub, 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 scrub. Okay, and this is the medication. So we're going to push slowly. And as I'm pushing, I will ask the patient if they feel any burning and examine the site. Okay. All right, and here is my saline flush. I would scrub before doing that. All right, now here's my flush. Aspirate and flush. Okay, and I would put on a rose cap just to keep that sterile. Okay, then I would examine again, assess the site, make sure the patient isn't feeling any kind of burning, and record what medication I gave and how much. And okay, so next we're going to hook up the piggyback. And I've already got my bag right there. So I'm going to hand hygiene, put on some more gloves. thing. I will do that here in a minute. All right, so I'm going to stop my primary. Okay, I just stopped. This is also clamped. I'm going to use the port closest to the primary bag. I'm going to scrub the hub. Okay, connect. All right, they're both still clamped. I'm going to drop my primary tubing. All right, now we will, now this should be dripping, but this shouldn't, so I will assess that. That's dripping and this one's not. Okay, then I will assess the site, ask the patient if there's any burning, and make sure there's no redness, swelling, anything like that. And I will come in and check on the patient in about 30 minutes to make sure there's no side effects going on. And I will report and record, remove my gloves, hand hygiene, clean up my supplies, and